The ethical issues of medical and/or recreational marijuana use during pregnancy by Corey Beniak for nursing NGC509 at the University at Buffalo. Let me start by first discussing the difference between medical and recreational marijuana. Medical marijuana is marijuana that is used to treat disease or relieve symptoms. Marijuana is made from the dried leaves and buds of the cannabis sativa plant. It can be smoked, inhaled, or ingested in food or tea, and medical marijuana is also available as a pill or in oil form. A doctor may prescribe medical marijuana to help with the treatment of symptoms in those with AIDS wasting syndrome, epilepsy, neuropathic pain, treatment of spasticity associated with MS, and cancer and chemotherapy-induced nausea. Recreational marijuana use is use of the before mentioned without medical justification. It's simply for pleasure. Marijuana remains a Schedule I drug under federal law, and federal law regulating marijuana supersedes state law. Because of the discrepancy between state and federal laws, people may still be arrested and charged with possession in states where marijuana for medical use is legal. The FDA has not recognized or approved the marijuana plant as medicine. Now, a total of 28 states, the District of Columbia, Guam, and Puerto Rico now do allow for comprehensive public medical marijuana and cannabis programs. New York is included. The Huffington Post reported a story claiming pot use among pregnant women has increased as much as 62% over the last 12 years. One leading theory experts concluded for the increase in use relates to the growing acceptance of medical marijuana as a treatment for nausea may have encouraged women to use cannabis to help them cope with morning sickness. Smoking pot during pregnancy is correlated to low birth weight, increased likeliness of NICU time, and long-lasting effects such as impulsivity and learning disabilities, etc. Further studies are suggested to isolate the use of marijuana and effects on fetal growth. However, it would be unethical. It is more likely nurses will be in the following scenario. If a patient admits to pot use, tests positive for pot use during pregnancy, or births a child with a positive tox screen, how should you as a nurse respond? The following is the 6-step process of ethical decision making. Gather relevant data. We've already established the potential harm to the fetus along with existence of ethical concerns regarding further research on pot smoking. But has the pregnant woman been prescribed medical marijuana? Did the prescribing clinician know she was pregnant? Is consuming pot during pregnancy legal? The New York State Department of Social Services includes misuse of drugs while responsible for a child as neglect. What can be identified is an ethical dilemma, a situation that involves 2 or more morally correct courses of action that cannot be followed. Say the mother was uneducated on harm to fetus and use was to eliminate nausea, but with education she would have not consumed the drug, versus consumption defines neglect and needs to be reported to CPS. Non-maleficence. With this approach, the nurse considers the focus to be on the possible side effects to the unborn fetus. Paternalism. This approach means protecting those with less knowledge or ability from themselves. Autonomy. Conflict arises when those among us who value autonomy and respect for differences argue that the individual must make his or her own best choices. Consult with colleagues regarding policy or protocol. Gather materials to educate pregnant mother on harmful effects of smoking marijuana. Seek for and advocate for alternate legal medications for nausea, such as approved antiemetics like diclegis, and research ANA Code of Ethics or policy statements related to the topic. What can be found is that the ANA actively supports patients' rights to legally and safely use of marijuana and related cannabinoids for therapeutic symptom management, as well as the nurse's promotion of quality of life for patients using such therapy. However, there are no findings that include cases of the pregnant mother. Provision 3 of the ANA Code of Ethics states the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. Both mother and baby are your patients. While maintaining the rights of mom, every attempt at advocating for and keeping baby safe must be made. So enforce the founded organizational policy or protocol, such as contacting CPS with the DSS, educate, obtain an alternate order to promote no further use of marijuana, and document. Assess for further use in future visits with expectant patients whom reported using medicinal or recreational marijuana, and inquire about and stay up to date with current prescribing laws until further research can be concluded.